Hey y'all, welcome to Moissage Therapy. I'm Moy, and today we're diving into one of my all-time favorite techniques, the pin and stretch. This technique is a game changer for addressing those tight upper fibers of the pectoralis major. Now, just a quick heads up, this is a passive movement, meaning you, the therapist, will be doing all of the work. So make sure to remind your patient to play dead. Start by externally rotating your patient's arm to open the area and gain better access to the upper fibers of the pec. Carefully palpate along the edge of the pec where it meets the clavicle to find clarity and pinpoint any hypertonic areas. Once you identify a good trigger point, sink in some pressure into the muscle belly. You'll want to support your patient's arm at the wrist for maximum control. Then gently pull the arm towards your waist. Start with about 30% to ease them in, then gradually increase as they relax into the stretch. A friendly reminder, always warm up the area before diving into any deep work. Spend a few minutes with light strokes or compressions to prepare the muscle. This will prevent unnecessary discomfort and help you sink in deeper as the tissue becomes more pliable. Once warmed up, start working your way distally along the lateral border of the sternum. For patients with more sensitive pecs, you can always dial back the intensity by using less acute tools. You have options, using the pads of your fingers for less intensity while still being targeted. A soft fit is broader and covers more surface area, making it more general and less acute. And finally, the palm offers a gentle, broad pressure that's perfect for those who need a lighter touch. It's all about finding what best works for your patient, so use your intuition and keep that communication going. Now, I'll take this time to remind you that muscles are three-dimensional. With that being said, we are now going to address the fibers underneath the pec with a second pin and stretch. Support the arm at the wrist. Then create some internal rotation of the arm to shorten the muscle belly. Get a solid grip in the pec, focusing on the emphasis of your thumb on the lower fibers, while your fingers maintain contact on the upper fibers. As you pull the pec towards the sternum immediately, externally rotate the arm at the same time, creating a Y pattern with the arm. Find a nice rhythmic motion that feels natural and fluid. Remember, move with grace. This should feel smooth, not rushed. Rinse and repeat as needed. For a broader but equally effective version of this technique, transition to using your fist. Follow the same principles, but remember, you're not ironing with a fist. Notice how my wrist is an extension and I'm slowly flexing and straightening it out. It's more of a fixed position with a gentle scooping movement. This is a soft fist. And since there's a lot of sensitive areas and bony landmarks here, move with care. As a bonus, this technique will also incorporate some work on the serratus anterior as you pass through the area. Okay, I swear this is the last pin and stretch. I call this one the T's, Y's, and I's. This move really helps wrap up the pec work and stretches everything out nicely. Let's dive right in. The major difference here is that we're starting with the shoulder and arm inflection. First, get a solid grip on the pec. Think of Alex Honnold climbing El Capitan. You want that strong, controlled hold. From here, allow the arm to abduct, creating a letter T with the body. I usually go for about 3 repetitions in each plane of motion, letting the pec release more each and every time. After the letter T, transition into the Y pattern. Pull the arm slightly higher. And finally, move into deep overhead extension to create the letter I. Keep in mind that not everyone has excellent range of motion like my patient here, so it's wise to explore some range of motion first. Check in with what your patient has available and adjust your movements accordingly. The goal is to work within their comfortable range of motion while still getting that productive stretch. Before we dive into stripping, let's take a moment to understand the pectoralis major. The pec major is a large fan-shaped muscle located in the chest, and it has 2 main parts, the clavicular head and the sternal head. The origin of the pec major includes the medial half of the clavicle, the sternum, and the cartilage of the first 6 ribs. It then inserts into the bicipital groove of the humerus. The function of the pec major is to assist with shoulder flexion, adduction, and internal rotation. This makes it a central muscle for any upper body movements and exercises, playing a significant role in activities that involve pushing or pressing. With this understanding of the pec major, we can now proceed with the stripping technique. Knowing the muscle's origin, insertion, and function will help us target it more precisely and effectively. Ever wonder why when you get massage you think, holy moly, that feels amazing? Then you wonder, I wonder if my stripping feels that good when I do it. Well, the answer is probably no. And let me explain. Most stripping techniques are less productive because of these three factors. First, I've found that many therapists strip at a 90-degree angle. This not only limits its effectiveness, but also puts strain on your MCP joint over time. To fix this, try supinating your arms and engaging your lats. This will help you secure a solid position. Second, make sure to stack your joints. Thumb, wrist, elbow, and shoulders should all be aligned. This alignment gives you more strength and control. Lastly, keep a small, gentle bend in your thumb at the PIP joint to create a more acute contact point. Start as close to the clavicle as possible, working towards the areola. Then move laterally across the pec, following along the sternal attachments. If your client mentions discomfort or tenderness, switch to using the pads of your thumb for a more broader, gentle approach. By the way, if you've been enjoying this video, I'd love for you to consider subscribing, but only do so if you feel like I've earned it. If not, no worries, maybe I'll get you in the next video. But do me a favor, give that like button a little Chipotle for me. Now, let's move on to the technique that leaves my patients feeling refreshed and rebalanced. Any patient who reports stiffness in the chest or pecs can likely benefit from the chest compressions or even a Platysma stretch. For this technique, make sure both the skin and your hands are almost dry. You want a good grip to drag the fascia, much more like a myofascial release. In fact, feel free to call it a myofascial release if you want. Start by pressing your palms just below the clavicles and instruct your patient to take a deep breath, starting in their stomach and expanding into their chest. They're essentially stretching their own fascia with their breath. Now, here's the important part. Make sure to cue them to exhale downward so they don't blow the air right into your face. Next, work unilaterally by applying pressure with your fingers, keeping your contact broad. And instruct them to turn their head away from you to stretch the platysma. If you want to intensify the stretch, gently pull the neck on the opposite direction, as if you're pulling the fascia apart. Repeat on both sides. Pretty cool, right? As we wrap up our session, remember that working the pecs is like unraveling a knot in a well-loved rope. Take your time, apply the right pressure, and watch everything come back into balance. And don't forget to subscribe and give that like button a little Chipotle for me. Until next time, I'm sending much love and peace your way. Adios.